These are methods to reduce residual neuromuscular blockade after a procedure that required neuromuscular blockade. You could use clinical testing like a head lift or hand grip. The mechanism here is that visual or physical assessment to detect severe blockade will help you avoid it. The limitation here is that you only detect significant weakness, so this alone is not sufficient. You can use shorter-acting, non-depolarizing neuromuscular blocking agents. These will have faster metabolism and clearance, which would reduce the risk of lingering blockade effects. You can have a qualitative neuromuscular monitor, like tetanus or train of 4 count. This will provide a visual and tactile feedback of muscle response to nerve stimulation. More important and more helpful is the quantitative train of 4 ratio monitoring. This will give you a precise measurement of your muscle response, and you can have a goal train of 4 ratio of at least 0.9 before emergence. This is probably the most important and the gold standard on this list. You can do routine neuromuscular blockade reversal. You should plan a reversal agent for each case that requires blockade. This can be neostigmine and glyco, or it could be sugammadex, depicted down here. Early reversal administration will allow for adequate time for reversal agent action before extubation. For instance, you don't want to immediately reverse the paralytic right at extubation. You want to give it enough time before extubation. You can reverse at higher train of 4 counts. You typically have better success when reversing if you don't have 0 twitches, if you have 1 or 2 twitches to start. You can also avoid total twitch suppression in general. Maintaining some low level of neuromuscular function usually keeps the patient paralyzed enough for the surgery, but also makes reversal more reliable. So instead of trying to keep the patient at 0 twitches, keep them at 1 twitch, perhaps. And lastly, sugammadex is very helpful because it's a direct binding and encapsulation of rocuronium, as you can see in the background image here. The advantage is that it's more reliable than neostigmine.